I'm Dr. Kate O'Brien from the World Health Organization. In this session, we'll discuss how pharmacists, particularly in low and middle-income countries, can help build trust in adult vaccination. We'll first have a look at the current state of adult vaccination and what drives that uptake. And then what we're going to do is explore the role of pharmacists in building trust in vaccination. After that, I'll share some top tips on how to have a meaningful and trust-building conversation on vaccination in your community. So I'm really pleased to get started with this session with all of you. As you know, immunization is a public health success story. It's helped people of all ages live longer and healthier lives. Apart from routine infant immunization, we now have several vaccines that are administered after childhood, and the benefits of vaccination have been extended to everyone at all ages. So let's look at how we're doing globally in terms of older adult vaccination. From this map that you see on the left-hand side, and you can see that there are many countries, around 63%, that do offer vaccines to older adults. But many low and middle income countries still don't, and you can especially see that in a couple of regions in the yellow. The availability of vaccines is one of many factors which drive vaccination uptake. So vaccine availability is not the only thing that drives vaccine uptake. To help us better understand these different drivers of vaccination uptake, we use the behavioral and social drivers, sometimes referred to as BESD, of vaccination. This is a framework that's been developed by a global expert group that was coordinated by WHO. These drivers can be grouped and measured into 4 categories or 4 domains. First are just people's thoughts and emotions. This includes the confidence in the benefits and safety of vaccination. And second are social influences. We get influenced by family members, by friends, and by community leaders. Third is motivation. That motivation is the intention towards vaccination. And the fourth are the practical issues. These are super important. These are practical issues, access-related factors, and that includes the availability, the convenience, the affordability, and the service satisfaction. We also know that these drivers can be specific in different settings or for different vaccines. So low vaccination uptake places both individuals and communities at risk of disease, and that can result in severe illness or even death. So let's just think about the importance of vaccinating against COVID-19 and influenza as examples. These vaccines are recommended for the same high-risk groups: older adults, people with chronic diseases, those with immunocompromising conditions, and those who are pregnant, as well as health workers. And when these groups, these adult groups, miss out on vaccines, they face a higher risk of hospitalization or even dying due to a vaccine-preventable disease. Therefore, it's really essential that health systems are set up to make vaccination easily accessible to these priority groups, and that culturally appropriate information is available, which helps enable people to seek and receive the recommended vaccines. Now, trust in vaccines and health system is one of the drivers for vaccination uptake. To build and strengthen such trust, it's really essential to work across many levels of society with families, with communities, with institutions, and health systems. In communities, pharmacists are a big trusted source of health information and advice. And because of your close interactions with members of your community, you are part of the community. You have a unique opportunity to support those conversations. You have a unique opportunity to build relationships and influence behaviors that foster and build trust in vaccines. In some settings, pharmacies may also provide vaccines and vaccination services to adults. So you have an important role as an advocate and as a provider of vaccine services in your community, and can help increase the uptake of vaccination for children, for adolescents, and for adults. So it's important that you're equipped with appropriate knowledge and skills to navigate conversations on vaccination, particularly those who may be unsure of the value of vaccine. And when there's an opportunity to talk about vaccination, you need to first determine where someone sits in the spectrum of being intentional to receive a vaccine. There are three main groups in this spectrum of intention: those who accept, those who decline, and those who are unsure. And these intentions can carry over time and can also be different in each community and different for vaccines. Most people accept vaccines and are really ready to receive them. When we see that someone belongs to this group, we affirm their decision to receive vaccines, and we answer any questions and direct them to the services that they need. Others may decline vaccines. To people belonging in this group, we raise awareness of the potential risks of not getting vaccinated and keep opportunities really open for future conversations. Just because somebody is declining at this moment in time doesn't mean that they're going to decline forever. So we really want to keep that conversation open. And we should avoid engaging in a debate that could risk your trusted relationship with them. And then there's some people in the middle who may be unsure or hesitant. That's another term that we use for them. Some may only accept certain vaccines and not others. Some may opt to delay vaccination, but they will go ahead and get vaccinated eventually. And for this group, our goal is to really encourage them to move toward accepting life-saving vaccines. There are different reasons for being unsure of receiving vaccines, as you've seen in the behavioral and social drivers earlier. Some may have some questions that they're not sure about. They're unresolved questions about vaccine safety or where a vaccine is manufactured. Others may have had a bad experience with a vaccination in the past, and so they're reluctant to get another vaccine. And some may have heard rumors from a friend or a relative, or they may not trust the government, the local government, the national government. Because the reasons can be so different, it's really critical that we avoid making any assumptions about why somebody is hesitating. Instead, we should take the time to listen and understand an individual's concerns. And by doing that, we can really tailor our answers, our responses, and share guidance that's both sensitive and specific to what they specifically need. So how do we do this in practice? There are three top tips that are grounded in behavioral sciences and best practices. The first is to listen and understand. The second is to get personal. And the third is to share knowledge and offer help. So let's just discuss these one by one. First, listening and understanding. Empathy is key because people trust those who make them feel heard and understood. So create an open space where people can express their questions and concerns without feeling judged. Avoid any urge to instantly correct, fix, or prescribe solutions. And simply acknowledge what they feel. State, for example, it's okay to have questions about vaccines. And then ask open-ended questions to explore more about their motivations. This can also help them work through their own thoughts. By actively listening and seeking to understand, we learn more about their questions and concerns, and so we now know how better to assist. The second is about getting personal. Share your story, your own reasons for wanting to get vaccinated, or maybe your experience when you or a loved one was vaccinated. In sharing your story, you may be able to connect with something that you have in common with the person. You can then use this connection to help the person find their own reasons to receive a vaccine. For example, if the person has identified with your concern about your family getting sick, you can reinforce the same motivation by saying, you can help reduce the risk of transmitting the illness to your family by getting vaccinated too. By getting personal, we open the possibility of identifying and speaking to the other person's motivations. And third, share knowledge and offer help. Before sharing trusted information, it would be good to ask for their permission first. This would make them be more willing to listen rather than feeling like you're pushing unwanted information on them. So just ask them, would you like to have more information about this? Remember also not to overwhelm people with facts and information. Speak to their motivations that you've identified in the prior step, not what you think they need to hear. And when you don't know the answer, or if you're unsure about how to address their concern, offer to help look for information. For example, if they don't know where to get the vaccine, share instructions on how to find a vaccination center. You can also offer practical help within your own capacity to make a vaccination appointment on their behalf if they wanted that. By sharing knowledge and offering help, we can bring them closer to a decision to receive vaccines and make the vaccination easier to do. So these are three practical tips that you can use in your next interaction with someone from your community who may be unsure about receiving vaccines. To learn more, you can explore the various WHO resources shown on screen here. These include a range of WHO guidance documents on increasing vaccination demand and uptake, and a searchable list of WHO questions and answers, which is a useful resource for technically sound and easily understandable responses to really commonly asked questions on vaccines. So just to wrap up, we encourage you to, as pharmacists, to make every interaction with your community members an opportunity to build trusted relationships. By leveraging your role as a dependable and trusted provider of health advice, you can help bolster overall trust in health systems and interventions. So just remember, first, listen and understand. Second, get personal and share something of your own experience. And third, really share your knowledge and offer help. Through these meaningful conversations on vaccines, you can help increase vaccination rates and safeguard your community's health. Thanks so much.